along with my spore student chapter team, we have visited to a village Safuwala, and along with our spore student chapter team and faculty members, we visited to one of the village nearby our radius, and we did the community outreach program, as well as we did the one lecture on first aid, as well as basic life support and anatomy of first aid box, where our Director Professor G.D. Gupta sir and SPORE core team president Dr. Kamaljeet and Secretary Dr. Abhishek Viju Kumar, along with the all office bearers of SPORE student chapter, went to the village and did counseling on first aid measures to all the villagers and tell about them about the processing of first aids into various conditions. And this is the post coming photograph session where you can see all the students working in terms of the community services as a department. And our setup, if I take about today's case, in a first aid kit at your home, at every place you should have this first aid kit, where there should be a first aid hard case bag, PBT medical gauze, hand pressing flashlight, multifunctional saber, safety pins, cotton stick, scissors, tourniquet, tape, adhesive bandages, medicines, say nasal decongestants, painkillers, anti-allergics, and in medicines used in constipation, diarrhea, ice pack, gauze pad, alcohol pad, cleaning wipe pad, and whistle. And you should have thermometer, triangular bandages, antiseptic wipes, adhesive tapes, first aid manuals, emergency informations, emergency blanket, as well as elastic bandages you should have. So this all the things are beneficial for you people to understand that you are in the need and the requirement of medicine in your life at any point, because medicines are the one which are the life saving ones. Okay, so this life saving medicines are particularly the requirement of the hour in the streamlined condition. So this World First Aid Day, and the theme given was the climate change. And as you understand that several parts of the world, as well as our nation, India, is suffering from flood. So we did particularly counseling on the flood, first aid also, and management. So in this particular regard, we went to the team and did the extensive job today. So, in continuation to this particular setup of the first aid kit anatomy, you should have ENO, you should have Glucon-D, Band-Aid, thermometer, some muscle relaxant, some adhesive tapes, some like ORS, sopramycin cream, neomycin, povidone iodine solutions. It may be animal bite, scorpion sting, honeybee sting, or particularly it may be a snake bite. So in this case, you can save the patient particularly. So it is a case where you can understand that the things which a pharmacist is supposed to do along with the studies, creating awareness amongst the communities, creating a structure of this parallel things where you can understand the value of the medicines, such as personal protective equipments, mask, gloves, and Dettol, and some painkillers like paracetamol, Dolo 650, etc. must be there. So this is one of the concern knowledge things which should be within you. And in this process of having shared knowledge, I would like to tell that this is one of the practice where you can understand that the first aid kit is very much required in your particular case of the home. So in your home particularly, you should have this first aid kit, and this first aid kits help you out in various measures where the temperamental level, daytime, nighttime, at any time you may be in the requirement of the medicines. And that is how this is one of the foremost thing one should do, one can do to have this medicines at your house. Understanding this, these are the essential medicines. So my next slide is pharmacist role in medication process has been widely changed nowadays, if you see. So in this condition, the pharmacist role, particularly prescribing, transcribing, dispensing, administration, and monitoring. Once a molecule is being administered, so it is a written order by a medical practitioner. So it ordered by a physician. That means you have to take it. And into the pros and cons, how to take the medicine, at what dose, at what route, at what indication, at what time, this transcribing, reading it. Pharmacists also play one of the role of dispensing cycle. Dispensing cycle is receiving the prescription, understanding the prescription, and after understanding the prescription, reviewing the prescription, either that medics are available or not. After that process, we come to know about the uh, process of patient counseling, and afterwards pharmacists also tell about the patient to the drug administration techniques and the monitorings of any side effects, adverse effects, or adverse drug reactions. So the quality of pharmaceutical care is to observe the drugs, observe the patients, patient counseling, any antiretroviral viral therapy, following of good pharmacy practices, and the development of a skilled pharmacist and on job training of the other pharmacists who are involved into regular process with you. So mine concern over here is just one concern, that providing the quality care services. So pharmacists are the one people to whom people look after for a concern which is called as the particular looking for the medicines guardianship. So over the counter drugs, prescription drugs, K drugs, narcotic drugs, etc. N number of drugs are available. Indian government in last 10 years, they gave a pharmacy practice regulation 2015. It was a gazetted regulations PPR in the New Delhi on the first month of the year and second, third week of January, where they gave one term called clinical pharmacist, who takes care of the provision of the pharmacy practice done by hospital pharmacist, community pharmacist, online pharmacist, e-pharmacist for e-pharmacy, as well as Janaushadhi Kendras, generic drugstores. So, clinical pharmacists, who are clinical pharmacists? Clinical pharmacists are the pharmacists who take cares in the medication, health, wellness, disease prevention, prophylaxis, and also concentrating at the level where you should feel that yes, the medicines are being guaranteed given in a particular setup. So, clinical pharmacists collaborate with the physicians and other healthcare professionals. On 1st February 2022, Pharmacy Council of India gave a gazette notification regarding the qualification status of the clinical pharmacist. And in the qualification status of clinical pharmacist, particularly, they said that PharmD, clinical pharmacist, should possess a PharmD degree, whereas now it is PharmD as well as M.Pharm pharmacy practice from the institution approved by the Pharmacy Council of India. So, what is clinical pharmacist? Pharmacists are drug experts. Clinical pharmacists take this knowledge and apply it to the clinical scenarios. Clinical pharmacists reform functions beyond fundamental dispensing and order processing activities. This typically involves optimization of medication selection, dosing, and monitoring. So there is a wide range on variety of activities that can be considered clinical pharmacy activity. What are the job roles of this pharmacist activities are to collect the data, subjective, objective, medication history, social demography history, assessing the information of the collected and analyze the clinical effects like side effects, adverse effects, and many more effects. So these are the effects which are responsible particularly in terms. So in this We need to see that the assess planning of the therapy, pharmaceutical care, implementation, pharmacists implement the care plan in collaboration with the healthcare professionals, particularly. So this is required. Why it is required? It is required because can understand that planning of a particular job role is also mandatory. So pharmacist job role is to plan the medication therapy of a patient with the some instructions and EBM concept. The medicine should be available, affordable, it should be non-toxic as well as cost effective. So pharmacoeconomics is also one of the concern which takes part into it. And one more concept which comes into the proportion is understanding the law of implementation by the patient, by the pharmacist, because once the therapy is not done in particular case, we need to see follow-up and monitoring and evaluate this, all the things. So this is one of the thing where we need to see the follow-up, monitor, evaluate the things as needed. So clinical pharmacist job role and particularly the salary package for clinical pharmacists ranges from 0.3 lakhs per month to 4.3 lakhs with an average salary of 25 to 45,000 freshman to 2 to 3 experience in get, and you can get into as a clinical pharmacist job roles to optimization of the therapy, clinical research, ward round, provision of drug information, can participate in drug-related problems, detections, medication-related problems like allergy condition, adverse drug reactions, side effects, drug interaction, therapeutic drug monitoring, patient counseling services, etc. And various CROs are available in the India. Like you can see the ICON, Quantinum India, Praxel, IQVIA, and a number of recruiters are there. Some hospitals are as a multi trial site. They are running up with this cases in particular. So this is the high time which goes up with this kind of activity. So online pharmaceutical portals, research centers, and you require as a qualified and licensed from the pharmacy council, as well as you should understand the thorough and the solid knowledge of medicines, its administration, safety profiling, and you should understand working on the systems, computers, as well as the databases, softwares. You should have effective clinical communication skills, either it is electronic communication, emailing, verbal, non-verbal, written, and you should be a troubleshooter. Aptitude should be a problem solving, decision making. Strong interpersonal relations and professional ethics must be followed. Whereas the clinical pharmacist, you need to see DRPs and antimicrobial stewardship, prescription auditing, and maybe after prescription auditing, rational drug therapy, advising the patient about the timing of the medications, storage of the medicine, assisting the patients in hospitals and surgeries, developing requirements for post-registration continued professional development for governing bodies. Examples of clinical pharmacist activity, you can go further. Why you can understand that I'm telling this thing because this is a job role where you have to understand that pharmacotherapy concern is having the effective therapy, and for effective therapy, evidence-based guideline and particularly standard treatment guidelines are available. What happens when this standard treatment guidelines are not followed by the physician or the medication adherence is not followed by the patient? Then some problems occur. And due to this problem, we need to certainly understand that the clinical pharmacist asks about your previous therapies in chronic cases if a revisit is there. If revisit is not there, it is entirely dependent on the patient, how and patient caretaker, assistant or relative or relatives or family persons are the responsible people for understanding that the medication adherence are very necessary. So, what happens when we govern with the law of clinical pharmacy, NABH accredited hospitals, where the management of medications, which comprises of NABH hospitals with management of medications, which is the third chapter of JCI accreditation, international patient safety goal you have to follow. So the functional services of pharmacy is not only clinical but also education, training, quality assurance, technical services, information technology, particularly governing with the medicine management, IT, technical services, purchase order, medicine supply, dispensary, storage are the other examples. So you should be guardian of the society, dealing with the patients in a very smiley face, asking about the patient's health status, medicine status, diagnostics and therapeutic status. So in the patient care, the therapeutic planning skills, drug information skills, physical assessment skills, patient monitoring skills, communication skills, knowledge of laboratory and diagnostic skills, knowledge of the disease, knowledge of the drug therapy, knowledge of the non-drug therapy, therapeutic planning skills, all are the important segment. Whereas when we come with the drug distribution in the hospitals, the administrative services, unit dose, dispensing, drug distribution, education, training for ASHA worker, USHA worker, wherein community pharmacy, wherein hospital nursing staff, hospital pharmacist, infusion admixtures, antimicrobial stewardship, then LASA drugs, narcotic and psychotropic substances, ineligible handwriting, decimal problems. So finding out this, apart from distributing in the central division as well as one point, it is also one of the duty in the hospital pharmacy of a hospital pharmacist to govern to dispense this proprietary product and its storage in a various manner. Because you have parenterals, nutraceuticals, cosmeceuticals, herbaceuticals, pharmaceuticals, packaging, purchase order, departmental services. At every point, you have that governance concern. So this is one of the main concerns where you need to understand that you are the one person who click on in various roles. So once you are with such kind of therapy, you can understand the segment. So the pharmacy, 5 hours, basically right patient, right time, right dose, right route, right strength, and right drug, and right diagnosis also, and the right person giving the medications, which is a pharmacist. So to clean your workplace, you also required 5S: sort, systematic arrangement, shine, standardize, and sustainability. In today's era, pharmacist plays a major role. Of World Pharmacist is very near. About after 12 days, we have World Pharmacist Day and National Pharmacovigilance Week starting from 17th of September. So the patient safety, medicine safety becomes our primary concern of care. So you have a lot of molecules at your place where you are understanding that particularly the molecule which particularly got up in your hospital pharmacy, chemicals, surgicals, rubber goods such as medicals, biologicals, liquors, alcohol preparations, and ointments are available. So with this hospital clinical pharmacy, there are n number of career opportunities in the clinical pharmacy, where with the description I have already discussed, like implementing the primary care services, drug information services, prescription audit, and particularly healthcare providers to deliver high quality care, insurance of accuracy of work completed by support personnel in compliance with the established policies and procedures. Particularly, we need to see this task. So in this task category, we go up with this insurance of work completed. So in particular in this segment, we need to assure the completion of the job description. So clinical pharmacist, where we need to categorize into three category: patient specific services, facility specific services, and global services, where patient counseling, patient education, drug interaction service, interaction or medscape.org, then drug therapy monitoring, drug disease management, pharmacogenomics, drug information pharmacist, pharmacokinetic/pharmacodynamic dosing, collaborative practice agreements, protocol, guidelines, and policy development and review, research, core, measure, and quality improvement initiatives, formulary management, hospital formulary, financial stewardship, medication safety, governmental and societal committees, agencies, societal guidelines and policy development, legal consultations, public health initiatives are the one. So hospital word is derived from the Latin word hospile, also means hospitality, where the hotel or the hostel is the same, where this all three words, hostel, hotel, and hospital, are derived from basically one source. There the meaning of the word will be the same. It means rest, food, and the care are available. So according to the WHO, the hospital is an integral part of social and medical organization, and the function of which is to provide population cure, prophylaxis, prevention from the diseases in out of the family and its environment. So according to the dictionaries, various definitions have been given. The main objective of hospital is irrespective of race, color, caste, and creed, and regardless to socio-economical status, you are taking care of patient. Provide care, cure, preventive services to all people irrespective of race, color, caste, creed, and economic and societal status. Protect the human beings with the jurisdictions, and providing training to involved in medical offenses, also providing in services, inpatient, outpatient, technical, and skills required for working in the hospital. R&D activities containing pharmacy education program, drug distribution program, and concentrating with the level of scopes of hospital. So in a scope of hospital, team approach, content of services, evaluation and research, integration, continuing of care, coordination is required. So what are the various functions of hospital pharmacist? So hospital pharmacist is a department of the hospital which deals with the procurement, storage, compounding, dispensing, manufacturing, testing, packaging, distribution of drugs, the practice of pharmacy within the hospital under the supervision of professional pharmacist is known as hospital pharmacist. As per the known history, the first pharmacy was established in the Baghdad in 754 AD. Hospital pharmacists are experts in medicines who work as part of multidisciplinary healthcare teams to manage the use of medicines in hospitals. And the pharmacist requirement on the hospitals of bed strength up to 50 beds, up to 100 beds, up to 200 beds, up to 300 beds, up to 500 beds. For 53, for 105, for 208, for 310, for 500 beds, 15 pharmacist is required. Retail pharmacist versus hospital pharmacist. Retail pharmacist deals with synthesis chemistry of medicines, medications, whereas the hospital pharmacist deal with individualized patient monitoring and evaluation, preparation of drugs, patient-centered care, dispensing medication services, working as integrated healthcare team directly involved in patient care, product focus, patient focus. What are the abilities required for hospital pharmacist? Administrative ability, ability to plan, organize, direct, and control the hospital pharmacy, maintain good human relation with other departments, where you have to work with the medics, paramedics, nursing, physio, dietitian, clinician, physician, MD, medical superintendent, nursing superintendent, blood bank manager, residential medical officer, emergency medical officers, interns, various CRM room machine, ECG machine, EEG machine, various lab technicians, various managerial profiles, and the pilots of emergency ambulances, emergency medical services, 108, etc. So I have to work day and night with all other peoples working as a staff in the hospital. And as a pharmacist, you should be able to guide about the medicines in pharmacy and therapeutic committee, preparation of hospital formulary, as well as preparation of the radioactive substances, nuclear pharmacy, chemotherapeutic agents, etc. And pharmacists should keep all the legal records, developing policy for prescription, like preparing hospital formulary, maintaining professional environment, and creating the code of ethics, and also making your services render available for the medical camps, and ongoing continuing pharmacy education program for apprentice pharmacists, and somehow in emergency hours can also render his or her services. You should be able to understand the technical aspects, technical knowledge of the medicines like pharmacokinetics and dynamics. You should be able to handle the counter, particularly working, inspire confidence in his medical colleagues, and somebody can ensure the quality of pharmaceutical products, especially generic preparations. Should have the ability to develop the manufacturing section, manufacture those preparations in hospitals which commercially not available in market, and control over supply, quality, and cost. The abilities required for hospital pharmacist, ability to control, total control should be there with the drugs and the other suppliers, with good relationship with the suppliers. Academic ability, act as trainer for nursing staff, pharmacy, medical staff, participation in various basic life support, advanced cardiac life support program, or going within the emergency medical services training program like crash card, refilling, auditing, and going with the first responder programs with this emergency medical services, or going at various level where the pharmacy medicines are widely used in minor OT, major OT, or at floor stock system or the centralized system. Roles and responsibilities of the indoor pharmacist, where the central dispensing area, coordination with the pharmaceutical needs of the patients, communicate effectively, check accuracy of dose, availability, do not therapy. Patient care areas, receiving the prescription, checking for the prescription error, counseling the patients, dispense required doses from prescribed, provide the information about side effects and adverse drug reactions, inform the patient about proper timetable of medication, activities beyond clinical patient care. A pharmacist serves as an important member of many policy making committees, including drug selection, antibiotics, hospital infections, working at the forefront of initiative and experimental care by investigating medicines in clinical trials, educating and training healthcare staff at various levels and patient about medicines management, common drug food interactions, and also knowing about the various updates for the national essential drug list, also like ranitidine we have. A pharmacist must have a team member capability to work in a team, integrate in a team with the doctor, with the nursing, with the physician, paramedico, medico, etc. And a pharmacist should under that diagnosis the prime for medication. So medication management, medication treatment, and disease illness treatment, symptomatic treatment, provisional treatment, or final treatment, final rehabilitation, education, prophylaxis, coordination with the clients for purchase, sales, and agencies with the facilities at all the managerial and administrative level. Continuity of care, continuity of client care will be available rendered by the particular services. Integration with both ambulatory, non-ambulatory patient like hemodialysis, ambulatory dialysis, and continuing with the integrated services. Evaluation, periodical evaluation program, and provision of conducting research included in the optimum health services for adequacy in the meeting needs of the patients and the community. So what are the requirement of the patient? What they want actually from you? Patient information leaflet, disease information, OTC information, or something like taking insulin, or particularly meter dose inhaler in case of asthma, or sublingual tablets, or food to be consumed before food, or medicines to be consumed before food or after food. So likewise, the clinical evaluation. So the functions with the patient care, diagnostics, therapeutics, OPD, IPD, medical nursing superintendent, medical containing pharmacy education, medical training, medical camps, and mortality meetings, pharmacy and therapeutic committee, prevention of disease, promotion of health, working with community medicine departments and forensic medicine department. Patient care, so quality care of the patient is must. Somebody is ill, sick, syndrome, disease disorder, something has happened to him or her, or in a roadside accident, somebody is injured, so restoration of the vital signs. The prophylactic action of a disease point from primary care, secondary care, tertiary care, and end care, with the proper code of ethics and the morals without any discrimination. Then the diagnosis and treatment of the disease with various biochemical, hematological, and radiological examinations of the patient to the inpatient. Broad function, there may be some division of medical, surgical, gynae, obstetrics, pediatrics, psychiatric, and other forms of rehabilitation. Involved in the entire inpatient services like modalities including nursing, dietetics, pharmaceutical skills, laboratory, X-ray services, varying refinement of diagnosis and therapy. Outpatient services, there are services to outpatient with an equality wide range of specialties and technical modalities. Medical education and training, hospital provides professional and technical education for many classes, like receive proper training of their choice with the medical, nursing, pharmacy, dental, laboratory technician, X-ray technicians, etc. And particularly medical nursing education research, profile access of the disease, promotion of health, personal hygiene, hair hygiene, dental hygiene, interim hygiene, and preparation of food, maintenance of this hygiene status in women, and this all kind of parameters counselor as a pharmacist can do, and the social and preventive pharmacy as well as community pharmacy and the hospital pharmacy at the level. So hospital are classified in many ways. If I talk about the classification of the hospital based on the system of the medicine, Ayurveda, Unani, Siddha, homeopathic, English medicine system, Chinese medicine system, Bengali management, and then size, objective, ownership, clinical basis, length of stay, etc. So in this classification, clinical, non-clinical, public, voluntary, charitable hospital, nursing homes, corporate hospitals, teaching hospitals, general hospitals, specialized hospitals, isolation hospitals, teaching cum research hospitals where the college is attached with like AIMS, JIPMER, care hospitals, general hospitals like PSC, CSCs, rural hospitals, specialized hospitals like ENT clinics, leprosy, oncology or gynecology or cardiology or physiotherapy, likewise. Isolation hospital like tuberculosis, scabies, dermatological disorders or COVID, so epidemic disease conditions based on to the size, number of bed. For if I say 500 bed teaching hospital, district hospital, 300 bed at Taluka hospital, 50 primary health center, 6 beds. So according to management, voluntary agency, union, state, local body, autonomous, private, civil hospital. So this hospital works under the government, either state government or the central government. Some other organization, corporations like railway, military, defense, steel authority of India limited, Western Coal Limiteds, etc. are the few examples of it. State government hospitals where the public directorate of health gives various capacities of list of hospitals like prison hospital, irrigation department, police hospitals, army hospitals, and Red Cross, UNICEF hospitals, some NGOs, non-government organizations hospitals, local body hospitals, municipal corporation hospitals, municipality hospitals or Jila Panchayat hospitals. Autonomous bodies like JIPMER, AIMS, ISAC, they also work in this proportion. Private hospitals like Asia Columbia, Fortis, Max, Mohali, etc. are the examples of the private hospitals. Voluntary agencies, voluntary body, a trust, a charitable society registered or recognized by the appropriate authority under central or state government laws. This includes hospitals run by missionary bodies and cooperatives. And classification of the hospitals according to system of medicine, allopathic, Ayurveda, homeopathic, Unani, etc. Then the process of referring to this medicines of non-proprietary products, it should be dispensed properly as per the good dispensing practices. Dispenser is a person who gives the medicines to the patients, and it is a pharmacist. So it holds a degree, diploma or master degree or PhD, and works in an organization for the rational and appropriate of use of medicines to the ill, sick, or the people. So what is proper products or a brand to we have medicines which come into the national formulary of India is called as proprietary. So proprietary products having of various therapeutic categories. So proprietary product is property of product owner, branding, large revenue, financial fortunes. So these products are particularly concentrated with the level of the understanding that medicine should be sold. So the range of dispensing containers, adequate shelves, lockable cabinets, Reference materials like physician desk reference, MIMS, patient information leaflets, some basic vital signs monitoring equipments like sphygmomanometer, glucometer, stethoscope, height and weight scale, standiometer, etc. Pharmacists should understand that we are in a prescription in hand, having ID, name, age of the patient, UTEC symbol, R, oblique, and a name, strength, dose for frequency, route, administration, and duration of treatment. Any additional instruction for pharmacists regarding the prescription supply, refill of the instructions, discharge medications, signature of the prescriber, understanding and interpreting the prescription, correctly interpret any abbreviation used by the prescriber, confirmation of dose, frequency, duration of each medicine, confirm that the doses prescribed are in the normal range of the patient. Correctly perform any calculation of dose, quantity to be issued, identify any common drug-drug interactions and contraindications. Selecting the medicine, an appropriate system should be established for selecting the medicines to prevent any medication error. Double check should be done to ensure that correct medicine is selected. Check the expiry date of dispensed medicine to ensure that they remain unexpired for duration of supply. First in, first out. And by formula of MRP, we can calculate the rate of a medicine where manufacturing cost, conversion cost, cost of packaging material, and particularly living charges. Multiply by 1 minus MAP. MAP is maximum allowable post-manufacturing expenses divided by 100 plus excise duty. As well as Indian government is putting GST tax. So this is how the price of any product is established for maximum retail price. So in the Drugs Price Control Order DPCO 1987, a past tax return of 40% on net worth and a return of 22% on capital employed and an integral return of 12% based on long-term marginal costing investment of new plant should be done. And inventory control techniques, already you know, ABC analysis is always better. Control, vital, essential, desirable, economic. Location for stocking, you can do with the decimal system, block system, fixed location, random location, zonal location, alphabetical order method, like for code Cs for capsule, Ts for tablet. You can do particularly block systems with 10.1, 10.2, 10.3, 10.4, 10.5. And with this particularly decimal system, in this system, the number in such a way that each digit represents the separate name under the heading. And the stocking of the drugs should be done properly, as I told yesterday. Functions of the stocking, maintenance of records, legal records should be maintained as per the Drugs and Cosmetics Act 40, Rules 1945, Poison Act 1999, 1919, as well as the Pharmacy Practice Regulation 2015. Understanding one flow is maintenance of registers. So what are the various registers like dispensing register, expiry register, LASA register, narcotic register, over-the-counter drugs, patient counseling register, information register, stock register, as well as certainly medical termination of Pregnancy Act register, the registration from Pharmacy Council, you should have license from the authorities, you should have rent agreement, bills, display window, xerox of prescription of controlled substances. Patient records should be submitted to the medical record department after the discharge from the inpatient. Patient records, PS records, PILs, telepharmacy communication logbook, prescription details, IP number, address, mail ID, diagnosis, medical legal documents. Financial records, either surgical, therapeutical, or diagnostics purposes, its control, its billing should be taken up. So in this whole, I would like to tell about the questions. What is the role of pharmacist in drug distribution system? List the categories of drug distribution system. What is ward basket system? What is pharmacy controlled ward-based impress system? Give the objectives of drug distribution system for inpatients. Give the advantages of individual prescription order system. Give the advantages of ward stock system. And what do you mean by the term inpatient? Long adenoma dispensing of drugs of inpatient, add a note on method system for inpatient drug distribution system, what is labeling, explain its patterns, add a note on discharging policy. Very long answer question, explain in detail about methods or system for inpatient drug distribution, add a note on dispensing of controlled drugs. For referential bibliography, a textbook authored by me, Nirali Prakashan, 7th semester in Go. And thank you so much for your patience listening. If you guys have any questions, I am happy to answer these questions. And as my team is telling that there are some questions, and Dr. Suresh Sir Vadakar has asked those is approved by Indian Medical Association. So Dr. Suresh, let me tell you, Indian Medical Association don't have to take rules. As per the NABS guidelines, there should be a quality department for clinical pharmacology. Clinical pharmacist, particularly under him or her, a clinical pharmacist work. Into it, there are some elements, objectives, and certainly some management of medications. In third chapter, there are 11 standards. So a clinical pharmacist worked in particularly in this job roles. So Indian Medical Association have a control over medical look after the regulations and next 6. Whereas when we talk about the pharmacy practice regulations, Drugs and Cosmetics Act 1940, Drugs and Cosmetics Rules 1945, Poison Act 1919, and Pharmacy 1950 about the roles and responsibility of a clinical pharmacist, hospital pharmacist, community pharmacist, and various other practicing profession of the pharmacy. So I hope I have answered your question, Suresh. And if any other questions are there, you can put in the chat box, and my IT team will definitely come to me with this question. If any other question is there, yeah. And there are some other questions by Bikram Bini. If a pharmacy fails to product during the inspection, what immediate requirements such as air conditioner, maintenance of freezer and cooler, ice-lined refrigerator if you are storing the vaccines in bulk. So in that category, they have their administrative powers to shut this kind of thing. So this is particularly one of the things pharmacist can do. So question here, no questions. So thank you so much for listening, and tomorrow again we will meet for lecture number 9 and 10. Till that time, thank you so much for your patience listening. Welcome to ISF College of Pharmacy once again.